Dr. Gruber's report underscores the cost effectiveness of this healthcare proposals moving through the legislature right now, AB 8 and the Senate version as well. Can you talk a little bit about why it is cost effective?
Well, it is cost effective because on the one end, we're asking employers to level the playing field and participate, to play a role in making sure that their workers have adequate health care. And there's a portion of the cost associated with providing health care for the employers that will come from the state and the federal government. But we want employers to elect to either purchase health care for their employees, a percentage of it, or to buy the health care for their employees into a larger pool of many small business employers, which will help maximize our ability to negotiate a lower rate for those that are uninsured. And so what we're asking is a 7.5% of payroll for every employer to pay towards the cost of the health care of their workers.
Now this will of course result in more of consumers getting a cost-effective result as well.
Well, it will in many ways. We're not just talking about the 6.5 million people that have absolutely no health care coverage today. We're also talking about how to improve upon the current health care system for the 80% of the people in the state that do have it and have seen their premiums skyrocket over the last several years. If you look at the cost of health care alone, they've increased at 2.5 times the rate of inflation just over the last several years. And so if we do nothing to solve the health care problem for the 6.5 million people that don't have it, we're actually in effect hurting people who are covered by a health insurance premium because their cost is going up. They're indirectly, in other words, subsidizing the health care of those who don't have it. And if we don't fix this problem once and for all, then ultimately the responsibility will weigh much more heavily on people who do have health care insurance to subsidize the cost of health care for those who don't have it.
This is the hidden tax that everyone keeps talking about.
This is in effect, the governor has called it a hidden tax. The California Healthcare Foundation just did a study recently that says that a working family of 4 pays $1,200 a month for the cost of the health insurance of people who end up in the emergency room because they have no health care. So when you break down the different opportunities to scale and balance the scales of who pays for what in the healthcare industry, obviously one aspect of that is employers, but there's more to this than just employers. You've got to clamp down on the health insurance industry because the health insurance industry is taking advantage of people. I mean, let's face it, when you see the vast majority of their money, that health insurance industry collects in the way of payments, that they hold on to the majority of this money and they spent very little of it back into the health care of the patients that need to be serviced. What we're going to do under my bill is we're going to require health insurance industry to spend 85% of every premium dollar back into patient care. That will also help balance those scales. In addition to obviously making sure that we contain costs, that we find our best practices in the medical arena, and that we have real transparency. We want to know if doctors are doing a good job. We want to know if hospitals are providing care adequately, if they're charging over billing or not. And we're going to take those best practice models and put them into place, and we're going to codify them so that the consumer benefits, so that ultimately we can have health care for every Californian and yet not see the cost of health care for those who pay into the system rise at the level that it's been rising over the last several years.
Last week you were out on the steps with a group of business leaders and the governor talking about a new coalition. Is it a key to have the employers involved in this as well?
Oh, there's no question that having employers at the table is incredibly important. Why? Because they're big stakeholders in this business of healthcare. If a worker doesn't have adequate health care, if their health care needs are not being met, they're not going to be productive in the workplace. And it's one thing for me to say it, I'm the Speaker of the Assembly. It's another thing for the President and CEO of Safeway, the President and CEO of Edison, the President and CEO of Kaiser, the President and CEO of Pacific Gas and Electric, and all the other 40 companies that stepped up to the plate and said it is time for employers to do their fair share. And I think this is important. But the emphasis that the business community and those that already pay for the cost of health care for their employees are saying that is really important, I think incredibly significant in this debate, is that we've got to have a focus on wellness and prevention, because ultimately down the line, that's going to save money. Steve Bird in Safeway is saying that over 2 years, he saved 30% in overhead costs to healthcare by focusing on wellness and prevention, by saying to his employees, if you stay healthy and don't smoke, I'm going to incentivize you. I'm going to give you a further reduction in your premium payment and things like that. I think all those things work. If you exercise several days a week, we're going to give you a credit towards the premium that you pay for your health care. And thus, if you don't take care of yourself, obviously there's a bigger risk to pay because you become a bigger cost to the healthcare system. So the idea here, I think, is to get employers to step up to the plate. But when you have over 40 businesses in California, these are California businesses saying it's time for employers to do their fair share, I think that's a loud statement to make by people from that community.